My name is Julien Frandon. I'm a French radiologist and I work in the south of France in a beautiful city named Nimes. So we were looking for a simple cryoablation technology and we discovered IceCure. So we have been using IceCure since 3 years. We found many benefits. First of all, the monoprobe technology is cost effective. So it was easier for us to introduce this technology in our hospital, because in France, you don't have a specific reimbursement for cryoablation. So it was easy with the hospital. After that, monoprobe technology are easier to use because you have only one probe, and it's easy for all my team to use it because it's the same as microwave or radiofrequency. So it was easy to introduce the system. And after that, it was really safe because since 2019, we have performed maybe 150 intervention, and we didn't have any major complication. So it's really very safe. So the benefit is the workflow. It's very easy to have liquid nitrogen. You just have to call your pathologist and you can have some. You don't need so many liquids. One bottle of 2 liters allow you to perform 20 minutes icing. So it's quite easy to use. You can find it everywhere. You can deplace your machine. It's a mobile machine. You can go to consultation. After you can go to your operating room. So the liquid nitrogen offers us the freedom to move the machine and to use it everywhere. When we have to destroy a tumor, we can choose many techniques. In my center, we have radiofrequency, we have microwaves or cryoablation, and the choice depends on the organ. For example, if we are in the liver, we don't use so many cryoablation because microwaves are faster and are very effective. But if we are in the kidney, for example, we will mainly use cryoablation because it's safer and you don't have lesion of the excretory system. When we go to the lungs, it depends on the size. When we want to do big ablations, we prefer cryoablation because in our experience, it's better tolerated than microwave or radiofrequency. If it's close to pleural space or close to mediastinum, we prefer use cryoablation because it's safer for soft tissue. And when we are in the skin or in other musculoskeletal localization close to the skin, we use cryoablation because it's safer. As a team, we are working on the immunological aspect of cryoablation. So we are studying that if when we perform cryoablation, maybe we will help the immune system like a vaccine against the tumor. So I think we have to work with the oncologist to better understand, and maybe tomorrow we will do the cryoablation with an immunostimulation, and maybe we can treat metastatic disease, I hope. So we are working on that. I think that interventional radiology is the future for sure, because we are making bigger and bigger ablation. So we are always pushing the limits. So the indications are increasing, the technology are being more and more invasive, minimally invasive, but with bigger and bigger ablation. So I think our indication will increase, and we have a lot of work to do, and we need many trainees to come with us and help us to treat the patients.